Welcome back to another session at the Geneva Health Forum, this time about the strategies to eliminate cervical cancer. Remember, for this session, we will be taking questions, so please remember to drop in those questions and we will leave some time at the very end to get around to maybe a couple of those. A few quick facts to kick off the session. Cervical cancer is the fourth most common cancer in women. In 2018, around 570,000 women were diagnosed with cervical cancer around the world. 99% of cervical cancer cases are actually linked to infection with HPV. And for those who are wondering, all of this information was actually taken from the World Health Organization. To help us break this topic down even further is Andreas Ulrich. He's a visiting scientist from Charité, also from the Universitätsmedizin Berlin. He's a former WHO staff and he has spent about 20 years on this subject. And as I understand, you're very passionate about this. So I'm looking forward to a very engaging discussion, and I'll let you take the floor from here.
Thank you very much, Olivia, for this nice introduction. Ladies and gentlemen, it's really a pleasure for me, and I would like to thank also the organizers of the Geneva Health Forum to give us the opportunity to talk about the ending of a story of cervical cancer, one of the cancers we can really eliminate. And I would like to show you what has happened in the night between yesterday and today, because by coincidence, this session follows the launching of the WHO cervical cancer strategy. And you see now that the world is united to fight against cervical cancer, because we have given a color to this cancer, which is teal. And the world was illuminated around the world to be united against cervical cancer, because cervical cancer is the most preventable and most treatable cancer of all cancer types, and no woman should die from cancer. I would like now to introduce the panel, and I can take off my mask. The distinguished panel is composed by Shannon Hader. She's the Deputy Secretary General from UN AIDS and the Director of Program, and she has spent 20 years, like me, in the area of global health and global cancer, in particular in HIV. And we have already met at the World Health Summit, and we are following up now on our discussion. I also would like to introduce Marieke Winrock. It's a great pleasure to have you on board. She is the Chief of Staff of the Global Fund to Fight AIDS, Tuberculosis, Malaria. Welcome to the Geneva Health Forum, Marieke. And then I would like to introduce Professor Patrick Pétignan. He is Chef de Service, Department of Oncology, Maternité of the University Hospital Geneva. So he is the clinician, and he has spent his life to deal with cancer in women, and he has a research portfolio specific to the screening of cervical cancer in low and middle income countries, in particular in Africa. So welcome, Patrick, to the panel. Can you hear us? So everything is fine. There's one panelist missing. That is Nono Similela from WHO. So she would speak to you now about the launching event of the cervical cancer, and I will improvise a little bit because two of you have been at this launching event, and probably Shannon, would you like to report a little bit what has happened yesterday, and then the audience we can bring in the discussion of today. Shannon, please.
Oh, sure, you bet. You know, yesterday was a fantastic event, actually, and I just want to congratulate Dr. Nono, who will be joining us, as well as Dr. Tedros, the head of WHO, for really bringing all the partners together to the extent that we not only have now this global plan for elimination that all partners sort of came together and signed on to, but that it's launched, and it's launched in a big way. And so yesterday did feel like both a celebration, but really a call to action. And we had survivors and voices of women who have fought and won against cervical cancer. We've had families of those who have lost the fight to cervical cancer. And we had ministry officials for national responses. We had first ladies, from Rwanda and South Africa, and we had great ambassadors, everything from Her Royal Highness princesses to pop stars. And so I think that really shows that when we have not just tools that we know how to use, not just demand to do better, but this sort of joined up political commitment with a plan, with commitments, with targets to move forward. Boy, is that an energizing launch, even during these times of COVID and difficulties.
And Marike, would you like to come in and also report to the audience what has happened yesterday? You were also on stage yesterday as representing Global Fund. Marike, please.
Yeah, I was in the virtual. Yeah, I was in the virtual stage and fully agree with what Shannon said. It was really, the energy was palpable, and I have challenged the cervical cancer community in the past that they were too modest, too soft-spoken, and so I've shared lessons from the HIV community that you should have a very strong advocacy movement. You should build that movement. You should focus on cervical cancer as an issue of women's rights, of social justice, and I see that happening, and we get that energy. So I felt really motivated. And if you allow me 30 seconds, I will rush upstairs because I have a shawl and exactly the same color, so I will be dressed more appropriately. Would you allow me 30 seconds?
Of course. In the meantime, I will just introduce our speaker who technically cannot yet be connected with us. Princess November Simelela is a gynecologist from South Africa. She has joined WHO 3 years ago as the advisor to Director General Dr. Tedros to take on the End Cervical Cancer strategy, which was launched yesterday, but it was called for it by Dr. Tedros 3 years ago. So he had a visionary idea about ending cervical cancer, and he called the famous and very distinguished specialist for gynecology and gynecology council from South Africa, Nono Simelela, and she joined, and within the last 3 years she put together all the pieces or the components of the program of cervical cancer, and she could launch it yesterday, and two of you were on board of that launching. In terms of bridging a little bit her absence, but I hope they will join us. As being very familiar with WHO strategy on cervical cancer, just would like to mention one point. We are promoting a comprehensive approach. Cervical cancer can be prevented through vaccination, HPV vaccination in HIV positives and HIV negatives. So that's very important as a message. And it needs to be given to adolescent girls. So this is a challenge, but we need to cover the whole world with this vaccine. Second, we can prevent completely cervical cancer because it goes in the course of the disease through a pre-cancer, a detectable precancer. And this is the area where gynecologists come in. Patrick, that's your day-to-day work. Precancer and invasive cancer. So we have a window. Every woman knows what screening means in high-income countries. However, not in low- and middle-income countries. Very rarely. We know that the prevalence of screening in low- and middle-income countries is very low. So there is a huge inequality in access to care. So we have to think about, when we talk about what is the next step after the launching, how to facilitate access to care in an equitable way to all women in the world, low, middle, and high-income countries. And we know that even in Switzerland, there are pockets of women who are not doing screening. So, Patrick, you might know about that. And we have still cases of invasive cancer, and women are dying from cervical cancer. So that's the comprehensive approach, and also the life course approach. It's important that we think about not women only from a reproductive health perspective, but of a health perspective across the life course. And with the SDG 3, we are not talking anymore about diseases, HIV, tuberculosis, malaria, reproductive conditions, but we are talking about health in general and health system and strengthening health system. And I would like now to come to the first questions after the launching. Shannon, what do you think can we do now from UNAIDS as a partnership of various UN agencies together, already an example of how we can work together? How can we do now cervical cancer in a comprehensive, strategic way to strengthen health system? Shannon, over to you, please.
Sure, you bet. Well, I think a few principles and a few actions. So, I guess in terms of the principles, a lot of the audience might realize, but I'm not sure if everyone realizes, why is UNAIDS at the table? And it's because HIV and cervical cancer are inextricably linked. Women living with HIV are more likely, 6 times more likely to develop invasive cervical cancer, and they develop it at a younger age than women who don't have HIV. But also, in countries with low HIV prevalence, only about 5% of all cervical cancer are among women living with HIV. But in countries with high HIV prevalence, over half of all cervical cancer cases are happening among women living with HIV. So we don't want to have services just for HIV that then ignore the entire risk for cervical cancer. And HIV and cervical cancer are also both diseases of inequalities and of health disparities. Women in Eastern and Southern Africa are 10 times as likely to die of cervical cancer compared to those in Western Europe or Australia. About 90% of girls in high-income countries have access to the HPV vaccine, whereas only about 10% of girls in lower-income countries have that access. But even within countries, we see these inequalities. In Malawi, for example, the wealthiest women living with HIV are 15 times more likely to have been screened for cervical cancer than are the poorest women living for HIV. So, our commitment is that we've got to integrate cervical cancer and HIV strategies and policies and service deliveries and community engagement to really address these inequalities in our strategies and also in our partnerships. So that's, I guess, a couple of the actions I wanted to highlight as well, is the action of partnerships. We need multiple levels of partnerships to really make an impact on these joined-up diseases. Big partnerships can be really important to empowering bold expectations and demonstrating that we can do this. We're part of the Go Further partnership that includes PEPFAR from the US, the Bush Institute, and Merck. And we're working together in sub-Saharan African countries to have screened in just 1 year over 1 million women for cervical cancer in HIV treatment settings. And, showing through big partnerships that such rapid scaling up of secondary prevention is possible is very important. But the second component of partnerships is really the partnerships that we need for scale and sustainability, which is the partnership and the support for community-led action, community-led organizations. This is critical both for advocacy and awareness raising with governments and decision makers and funders, but also particularly for demand creation for these services among women at risk for HIV in the community, and demand that services that are provided are a full continuation or continuum of services, and that they're high quality. They're the kind of services that women want to access. So for the first time ever for UNAIDS, we will have a cervical cancer HIV integration target that will be part of our global HIV targets for 2021 and beyond. And that will be fully integrated into the next global AIDS strategy that we're leading the development of right now.
Thank you very much, Shannon. I just got the information from the regie that Dr. Similela is now with us. I hope she can listen to me. Hi. How are you?
Hi.
Are you around? So thank
How
you. I already have introduced you, and I would like to give you the floor now to report also what are your feelings about the launching. What would you like to give to this audience, which mostly didn't have the chance to attend the launching because they were busy with the Geneva Health Forum. So the floor is yours. No, please.
Okay. Thanks, Andreas. I see my colleagues who also participated in the launch, and we'll use this time to thank them both, Shannon and Mareike. Thank you so much. I think purposefully yesterday, we wanted to focus on the women who have survived cervical cancer. We felt that a lot of the discussions until now were technical discussions, which is necessary for developing a strategy. We had heard from civil society in the Africa region, mostly through our work with UNAIDS. We were able to mobilize communities in the very first consultation. That was important, but not enough, I think, to get us to a point where we can see and truly believe in the fact that with an HPV vaccine, with early screening and treatment, there is a possibility, very strong possibility for women to live fulfilling lives like we saw yesterday. We also were able, although this is something that was not, we could not show yesterday because many of the countries that were working with us had found ways to illuminate monuments across the world in the color teal. 90 monuments right up from the Niagara Falls to Kenya, from Australia to Canada. It was just incredible. And that for me was a sign of solidarity, to have people in the middle of COVID-19 take a moment to just acknowledge the fact that there is something like cervical cancer, even if it's far away from many of them, they still were able to embrace this. So I think there's a huge momentum now which we should really latch on. And I think for us in WHO, the way I'm looking at what the next steps should look like is precisely what Shannon has just said. We unfortunately will not see one donor coming in or the ability to have a vertical program, and we shouldn't do that. So we should piggyback on the programs that are already in place, because that's where women go. So the approach should be integrate with HIV services, bring this into sexual and reproductive health services, do the community outreach, but as a comprehensive integrated program. That is where we will actually make gains. And the work that's being done, it was shown yesterday during the launch. Rwanda is already using the HPV DNA testing to screen women. And we saw yesterday that the results were available almost on the same day. And then they are using thermal ablation, the new technology, which we are working with partners to have a reduction in prices. We want to get the package to less than $1 for screen and treat with the technologies that are available now. So we are really looking forward to pushing that agenda, but integrating it in a way that is sensitive to the needs of women. It really decreases the multiple visits to the facilities, and it just makes it easier to get, we like to say, a one-stop shop type approach, and that truly makes a difference. And, our relationship and partnership also with the Global Fund, I'm sure Mareike will speak a bit more about it if she hasn't already. That is so important, because to have this commitment means that, the resources that are already available, countries can also use to expand care to services, care and access to services. So we need to be strategic about what we do, but I see a huge opportunity. Then we need to look at other regions, Southeast Asia. What is going to be the strategy there for implementation? We need to sit with the colleagues there and figure this out. It's a big country, and we need to find context-appropriate ways of reaching out and making sure that they are also able to move their agenda. Our colleagues in the European office, in PAHO, also face a different challenge. In Europe, they have a huge challenge with vaccine hesitancy. So that was the first thing they raised when we asked them, how would you like us to help to deal with this wave of anti-vaccines and to really bring the comprehensive services into place. So we've got countries, as Shannon mentioned, that are very close to the target that we've set for elimination. And then there are others like Eswatini that are way back. But Eswatini is a small country. It's already receiving PEPFAR, Global Fund, and many other donor resources. I think what's missing is a coordination at the country level and really creating demand and community mobilization. So I think we need to pivot our approaches now. We've done a lot of work at the global level. We need to now change the tools, the guidelines and documents that we have into actionable things with the right tools for providers to work with. So I think that is the overarching message, But the launch overall was more about that advocacy wanted to raise the profile of the citizens and people to think about they make the connect and somebody that
so the connectivity is
to deal with breast cancer.
A little bit bad. Probably go. Thank you so much. No.
Really, that integration.
Okay.
Is it bad?
No, I think we could. Just the last minutes were cut, but I thank you very much, Nono, for your very inspiring words. And we were talking a lot about very specific technicalities on the ground. And I would like to give the floor to Patrick, who has worked over 20 years in Cameroon in a partnership between the Canton de Geneva to Cameroon at a political level. And you worked on the ground on how to develop capacity in screening, in getting women to screening, and using innovative technologies for screening and treating. Patrick, over to you.
Okay, thank you very much, Andrea, for the introduction and for inviting me to this session. And I think also that it is a very great moment now to work together and to fight against this cancer. And as you say before, this is the vaccine. The vaccine against HPV is probably the biggest and discovery that we have in the field of gynecological cancer, and also cervical cancer screening, and also to treat patients having cancer, and also include palliative care. And our experience, as you say before, is with Ministry of Health from Cameroon and University of Geneva, University of Yaoundé, and a different partnership that we have developed since 20 years with the aim to develop an innovative and adopt innovative technology for cervical cancer screening. And I think that the last 5 years, we have not only us, but the different group working in Sub-Saharan Africa, and other countries, that probably there are three innovations that now we can use in the different country. And probably the first one is the possibility to use HPV as primary screening. And probably this method, if it can be implemented, is better than what we have used before with only VIA. And okay, VIA is probably a good method also, but we need a quality control for having a very good VIA. Otherwise, VIA has important weakness. And having the possibility to use HPV as primary screening, as you know now, we have the possibility to use point-of-care test. It means that you can have the test in less than 3 hours or less than 1 hour having the test. Second, you have the possibility to do self-sampling. It means that you don't have to do pelvic exam to all the women, but only to a part of them, only women having an HPV positive test. If you use HPV as primary screening, almost 80% of the women will be HPV negative. And for these women, you can say that the risk to have a cancer in the next 5 to 10 years is very, very, very low. And you have to focus your effort only on women having an HPV positive test. And probably we need a triage for women having an HPV positive test because it is 20% of the population. I mean, a population between 30 and 50 years old. And for this, we use, and many other groups use VIA as a triage. I mean, application of Viagra on the cervix, and if you see a whitening, it means that you have a precancer. But the technique is not so easy, because you need the training, retraining, supervision to have a good quality of VIA. And probably the development of digital imaging, I mean, camera or smartphone. And this is really a big advantage to use this because you can share the picture with colleagues, you can ask an advice from an expert, and also you can use for teaching and for improving your practice. And finally, the possibility to treat with thermoablation. I think this is really a big progress because it's very effective. You can use it without anesthesia. It takes a couple of minutes and with a very good result. I think these three developments, and all of them are in the last 5 years: HPV screening, self-sampling, test with a point of care, and VIA with digital imaging, and after the treatment with thermoablation is a very important progress that we have made this last year. And I think that it can be used in very remote area. Now we are working in the West Cameroon in a district hospital, and it works very well.
Thank you very much, Patrick, for this impressive report of the work of the Geneva Hospital, or Geneva University Hospital. And I would like now to hand over to Marieke Winrock. The Global Fund was able to curb the epidemic of HIV and has a lot of experience in dealing with a very difficult to treat condition in the field. What could be the lessons learned from Global Fund now to deal with cervical cancer, which is an expanding disease and is increasing worldwide still? Marieke, over to you.
Thank you very much. And I'm also really pleased to hear that the Global Fund has been supporting countries to implement some of the tools the previous speaker supported. The Global Fund indeed is focused on HIV and malaria, which we realized a couple of years ago that there are certain co-infections and comorbidities that actually disproportionately impact people living with HIV. And cervical cancer absolutely is, and Shannon provided all the data, a very important comorbidity. So in 2015, 5 years ago, our board passed a decision point to expand our mandate to include those co-infections and comorbidities and encourage countries to include them in funding requests. It has a bit of a, we've absolutely seen progress, and I'm really pleased to see that it has been taking up more enthusiastically by countries more recently. So Zambia was the first country. There's a very strong political commitment in Zambia, and so no surprise that they were the first to really take advantage of this new policy, and they use grant savings to include cervical cancer prevention and treatment into their ART programs. And I think both Shannon and Nona really alluded to the importance of full integration in existing services. And since then, other countries have progressively prioritized such intervention. So we started from a small investment of $900,000 in the 2016-2018 cycle. This increased to 3.3 million in then the cycle that came thereafter. And the current cycle, countries are still submitting proposals, but we are already at 10 million. So, and counting, I hope. So it's really, we see increased uptake. It has not always been easy. In many countries, programs are very siloed. And so it's both the cervical cancer and the cancer programs that were quite separate from the HIV programs, and HIV programs that initially were very focused on just HIV. And I think it's more recently that it's a real recognition that you have to look at much more integrated and comprehensive services. So we slowly are seeing that we can overcome those barriers by working together, and we see increased energy momentum. And the launch yesterday really will contribute to that. We've also done from our side our best to advocate and amplify the opportunities for countries. So for the current funding cycle, it has been a much higher uptake. We have been very proactively including very specific guidance to countries in the tools that they use to inform their the development of the funding request, both for sexual reproductive health, resilient and sustainable systems for health, and HIV programs. So we've provided very concrete guidance on how cervical cancer screening and treatment can be included in those programs. And we've also worked very closely with civil society, with advocates, and with WHO and UNAIDS to develop and disseminate those messages during the country dialogues. And so we're really pleased to see that this increased effort has really paid off. So the Global Fund, none of you have referred to the Global Fund as an important ally. We are an important ally, but also would like to recognize that our investment will necessarily need to be catalytic. And we can provide a stimulus for increasing resources from a broader coalition of donors and domestic resources, but Global Fund alone will not be sufficient to cover all the needs, but we're absolutely part of this partnership. Really pleased to see that UNAIDS in their next strategy, they're focusing more. We are in the process of developing our strategy for the next 2023 and beyond. And I really hope that we can have even greater focus on those comorbidities and co-infections. I've said very often, it's from a Global Fund perspective, it doesn't really make a lot of sense if we provide treatment to people living with HIV and keep them alive and then let them die of cervical cancer. That does not make it doesn't make sense from a humanitarian perspective. It also doesn't make sense from an economic perspective. So we are fully on board.
Thank you very much. This is a very important sign that we have UN Geneva-based organizations to exchange their idea. That's not trivial. We have to overcome barriers, institutional barriers, and also mandates. And we are working according to mandates from the member states. But we see increasingly willingness also by the member states and the UN Universal Health Coverage declaration that we have to join efforts and that we have to focus on health system strengthening to back up what we have already implemented in the countries. Simulela, what would you like to see over the next 3 years as key actions now in implementing the strategy? What is your feeling what we could do really as a next step? Let us in a very short run of 3 years to make sure that everybody has understood that we are active in implementing the strategy. Over to you. I think she was not connected. So, no. Did you hear my question? No.
I think.
Okay. She's connected. So we are.
No, three key things that be done or should be done.
Yeah.
Hear me?
Oh. So connectivity within Geneva is sometimes more difficult than around the globe. Yeah. No, we are not connected. Okay, so Shannon, what do you think next 3 years? What could you do with UN-SIDA, UN-AIDS, together with HUG, WHO, and the Global Fund? 3 years. Now we have to tackle that.
Yeah. I think there's probably lots of echo. 3 or 4 things I'd focus on. First is that we can join up efforts for political will and accountability. That includes using this target setting that are part of the elimination plan. These targets of 90, 70, 90 for HPV vaccination, cervical cancer screening and treatment. Targets can sometimes sound sterile, but they're not. They're numbers of people you need to reach. And we know from experience that after you set those global targets, working with countries to know what does that mean to us on the ground, how many women, where, whom, and how that translates to a plan is very important. And that actually really does help drive the political will and the accountability. Second, maybe to build on that theme of partnerships and say in this next 3 years, I think we need to vastly expand, scale up our partnerships with innovators for the low cost, easy to use, and self-care technologies. We heard from Nono about self-screening. We heard from Patrick about some of the remote imaging or telephone visuals that could help with the second layer of screening. So I think whether it's self-collection of samples, whether it's artificial intelligence-assisted diagnostic technologies, whether it is portable battery-run thermocoagulators for treatment, we know that these innovations can be easily integrated into HIV testing and treatment settings. And we know from experience that these sort of self-care or easier to use technologies are very welcome at a human level. And we want communities to have a role in those partnerships so they can also be a huge player in advocacy and demand creation for these new innovations. And then finally, I also want to build on something that Patrick said. We need more partnerships and investments for treatment of advanced cervical cancer as well. Sometimes we take a public health response that somehow only emphasizes prevention or early diagnosis and treatment, which are critical and we want to see more of. But we can't do that without also investing in treatment modalities for advanced cancer. We can't say, once you get to a point, we've got nothing for you. That does nothing but perpetuate stigma and shame. And in fact, what we need to do is to create empowerment and hope. And having advanced treatment that includes radiotherapy, other interventions is very important to that. And then finally, I think we can really create a movement for equal access to HPV vaccination for all young women around the world, not just those in wealthy countries, because that's going to be our long-term investment that's really going to pay off for eradication as well. So those would be probably my 4 priorities for what we do together.
Thank you so much, Shannon. I think now it's Patrick to come in with the management of cancer and how hospital partnerships can pay off, can create capacity around the world to manage invasive cancer. What is your experience with working with Yaoundé over the last 20 years in training and exchange of expertise?
But the best thing that we can do is to prevent cervical cancer, I think. Can you hear me? Because there's okay. And I think most of our effort should be in the prevention with the vaccine and the prevention with the screening. Because as you know, this cancer is quite different as breast cancer. Because, for example, breast cancer, the screening, you have a small cancer and you want to detect very early the cancer and after to initiate the treatment. But for cervical cancer, it's quite different. You have to identify not a cancer, but you have to identify a precancer. And if you treat the precancer, you avoid the cancer. And for this, I think you can be very efficient with the screening to reduce cervical cancer. And probably the most impact that we can have is vaccine and secondary prevention with screening. After, for treating a cervical cancer, it can be quite difficult. If it is a very early stages, okay, there is a large place for the surgery. But if it is an advanced stage, and most of the cases is advanced stage in sub-Saharan Africa, and unfortunately, it's difficult to treat. There are radiochemotherapy, but it's very difficult to treat. And we have also to have teaching for palliative care and how to support women having metastatic disease, having locally advanced stage. That is incurable, but you can give support. And for this, I think that we can bring an important contribution.
Thank you so much. But just on the management, you trained gynecologists from Yaoundé over years, and they are now head of the department, and you are in contact with. It's feasible to do management of cancer also in Yaoundé, yes?
Yeah, because you know we have a partnership between University of Geneva and Ministry of Cameroon since more than 40 years. We have this partnership is we have medical doctors from Cameroon. They have the possibility to come in Geneva, but it can be plastician, it can be orthopedics, gyne-onc, and every medical doctor. And on the other side, our students are going in Cameroon for 1 month, 2 months, or 3 months. This is an exchange, and it works very well now since more than 40 years. And during this period, more than 100, maybe 150 medical doctors from Cameroon have been trained in Geneva. And many of them are now professors in Cameroon, and we have many exchange. And yes, we have a couple. We are the capacity for doing surgery for cervical cancer.
Okay, thank you very much. This is, I think, very important that we can, by creating hospital partnerships, and I'm talking now as a Charité University Hospital Berlin, where we're creating also hospital partnerships with Africa, with Asia, across the world. We can increase also the management part, which is also very nicely outlined by Shannon. Marieke, over the next 3 years, there are several replenishment dates. Do you think you can include cervical cancer in that portfolio, or should it be integrated in a broader framework of health system strengthening? Marieke, over you.
There's different answers I can give here. Well, first of all, I think very clearly I would love the Global Fund to expand into cervical cancer and really make sure that cervical cancer programs are integrated in all HIV programs in every country in the world, and Global Fund would fund them. But of course, we depend very much on our donors to fund and to provide the funding that will be needed to cover all those costs. Here, as I said, we are in a moment developing our strategy, and I think one of the key areas in those discussions will be to what extent will the Global Fund look beyond HTB and malaria and health systems more narrowly, to what extent will it government mandate, and it's the board that will have those discussions. And then the next question is how will it be funded, because if we have to fund within our current envelope and we expand the mandate, then there's really important trade-offs and really difficult decisions that have to be made. So ideal world, I definitely would want us to raise even more money and be able to support countries in a more comprehensive way. I think at the end of the day, this is all, and I think it was the first point that Shannon started with. This is very much about political will, political leadership, and what we have seen that the countries that were able to really break through silos, to really focus on women's rights, on women's access to health, and breaking the barriers. Those are the countries with very strong political leadership. So I fully aligned with Shannon that you should have an alliance to really work with countries and to build that political commitment and accountability. HIV, of its cervical cancer screening and treatment program, should be part and parcel of every HIV program. It should be part and parcel of every sexual and reproductive health program. Women that go to a clinic for advice on family planning, they should be offered cervical cancer screening. So I think there's it should be part of our HIV programs, of our sexual reproductive and health programs, of health systems programs. It really should be integrated in all those programs. And just picking up on the element that Shannon talked about, community engagement, that's really important. I think if there's one lesson that we have learned from the HIV response, it's the critical role of communities, of engaging communities in response, in the definition of problems, and really have communities a part of the solution, a part of the response. And I think for cervical cancer, we slowly start to build that movement. It was really fantastic, Nono, in the event yesterday. You had such strong voices from people, survivors of cervical cancer. I think increasingly those are the voices that will influence politicians, that really will help to build a political commitment. So all for engaging the communities and building this very strong movement.
Thank you very much. Now we have some questions from the audience. Olivia, you will come in and bring the audience on board.
Sure, we just have two questions, but I will start with the first one. And someone from the audience asked, do you expect artificial intelligence to come soon as part of the solution in addressing cervical cancer? And I'd like to open that up. Who would like to take this one for us?
We were talking about artificial intelligence as part of your strategy. Have you included that? Will be that part of your implementation work to get the technologies on board? Oh no, doesn't work.
Can you hear me?
Yes, about artificial intelligence.
Okay. Yes, it should be coming soon. At the moment, we've got in countries in South Africa and in India where they are testing the artificial intelligence diagnostics. So we are hoping that by the first quarter of 2021, we should be getting their results and moving towards scaling up. So we're very, very optimistic because as we speak, using these technologies to see well they work, and really we should be able to scale up it in the latter part of 2021.
Thank you very much. Second question?
Thank you.
Okay, I would let you take this one, and it's regarding training.
Okay. So training, where can we, I think it's a key element, and thank you for this question to the audience. Training, capacity building, having skillful healthcare providers is important. So Patrick, you have already mentioned that you are training, your institution is training. Where do you see chances to expand this kind of cooperation worldwide and solidarity?
Yes, thank you for these questions. I think that can be a very important contribution that we can bring is teaching. I mean, not only university, but also society like European Society of Gynecology Oncology or Society of Oncology. And we can bring our experience in teaching for cervical cancer, for how to do a VIA exam, how we do this kind of therapy or other kind of therapy. And I think that it can be a very good support for country. And for example, we are discussing now with a 6-pack which regroup different African country, French-speaking African country, and they are looking what kind of, if we can bring a support for, because they plan to do a certification for healthcare provider doing screening. And probably our contribution from university from the north and big society of oncology, what kind of support we can bring to support the health system and to support certification. This is my opinion.
Thank you very much. Shannon, if you talk a little bit in a larger perspective of educating the public, how could you see education as part of your portfolio? What is your experience and what is the role of public education, health education in the context of cervical cancer? Shannon.
Yeah. I think we have a lot of lessons learned that education is really not just about facts. It's also about decreasing stigma or shame or things that make people embarrassed or hesitant or want them to avoid a topic. I think traditionally, when it comes to women's health issues, not everybody wants to sit around talking about women's health issues. Not everyone's going to walk into a clinic and demand the kind of screenings that we're talking about here. And so I think education can be multifold. First, it's got to start with the idea that there's a purpose for having what are sometimes difficult or awkward conversations. And that purpose is we have got a disease that is not only nearly 100% preventable for this next generation of young women, but if caught early, can have absolutely fantastic health outcomes. Second, that services are both becoming available, but also they're evolving to be much more manageable and desirable. Some of these self-testing, self-care technologies are a great introduction. And then I think the third element of education really has to do with testimonials of lived experiences. It really, frankly, doesn't matter what I have to say about cervical cancer. It does matter what women in their own communities say to not just other women, but other men of families, saying that this is an issue, that if we grapple with it, if you learn from my experience, we can transform our community so that no one has to lose a mother or a daughter or a sister or a friend.
Thank you very much. Marike, education, prevention is a major subject and an important tool to prevent HIV. What is your lessons learned for now for the cancer community? How can we learn from you?
I think two messages. I think first of all, to add to what Shannon just said, I think education is incredibly important to tackle stigma. I've been really shocked and moved by so many testimonies of women survivors of cervical cancer who talked about the stigma they face in their community, even by their family. And I think education can actually help. And in the HIV community, in the T community, we have a long experience how stigma and discrimination really limit access to services. It's absolutely critical to address that. I think on education, and I was just reflecting, so I was listening to some discussions and early actions we're having with Gavi around supporting adolescent girls and young women in a very comprehensive way. We know that adolescent girls and young women are disproportionately impacted by HIV in Eastern and Southern Africa. And there's a whole range of factors, but gender inequalities is main driver. We also know the same group that Gavi wants to target for HPV vaccination. So it's really important to work together, and not just from the sort of the angle of preventing cervical cancer, but it's about trying to support adolescent girls and young women in such a way that you really give them the best chances for the future. And preventing cervical cancer is absolutely key. Preventing HIV is absolutely key, but it also makes sure that they can follow an education, that they have economic opportunities, that they are empowered to have tough conversations with their male counterparts, and that they really feel empowered and supported to make the best of their lives. So it's absolutely critical.
Thank you so much. We have 5 more minutes. I would like to ask every speaker to have one key message to our distinguished audience of the Geneva Health Forum. What would you, Similela, what would you like to convey in one sentence? What next?
My message is that, had this cancer horizon for a long time. We've had a lot of science able to create a strong social movement for people to be conscious of cervical cancer. So my message to the Health Forum is that the Geneva Health Forum is to expand the training opportunities to ensure that when you have provided these opportunities, the trainees or the doctors who qualify go back to their countries to serve. But basically, the main message is we've got to continue to advocate. We must, the work starts now. Got to find creative ways to get to the politicians and to make them understand the trade-offs. The point that Shannon raised, what is the point of investing so much into managing HIV?
Okay. Thank you. And now we go over to Shannon. What is your final statement? One sentence.
Correct that they I'm
going to add
promote.
I'm going to add to Nono's urgency and say that even in a time of COVID, now's not the time to wait, to expect less, or to stop our expectations. We are seeing now the very real costs of failing to invest in health writ large when we're seeing these impacts of COVID. Now's not the time to expect less, but to say, how do we start action? How do we recover from services that have been interrupted? And how do we prevent these current and future pandemics of cervical cancer by starting to act now and with urgency?
Thank you, Shannon. Patrick, what is your message for the eternity? Patrick, yeah? one minute.
Okay, we have still a long way to do, I think. But everything is quite here to reach and to end this cancer. Is to promote the vaccine and to convince the population that this is probably the most important things that we can do is to accept the vaccine. And second, for the prevention, probably we will have in the next year new and discover and new innovative technology like artificial intelligence and so. And of course, if these two things works well, probably you don't have cervical cancer or very, very, very few cervical cancer. And the number of people that you have to treat for cervical cancer will be drastically reduced. And but now I think also we have to promote also teaching for how to manage women having advanced stage of cervical cancer and palliative care and how we can support this condition, because this is a very frequent disease and very frequent situation.
Maike.
Given the constraints of time.
Yes, Maike.
One
sentence. One sentence. Maike. Yes, the Global Fund. One final statement, please, Maike.
It's 2 sentences. I want to go back to the moment when this policy was approved, which didn't cover just cervical cancer, also hepatitis and other comorbidities. And one of our board members mentioned that in the preparation for that session, he got 47 males advocating for hepatitis to include it, only 1 for cervical cancer. And that made me realize that the women we're talking about, the most vulnerable, are the poor women in low and middle income countries with limited access to health services. Fundamentally, this is about women's health, about social justice and inequity. Thank you.
Thank you so much. Now we have 14 seconds, and I think we we are all in Geneva. I think this, I thank you so much, the whole panel, and also Nono Simelela. Unfortunately, we have this connectivity problem, but Geneva is full of organization, of UN, of HUG, and I would like to propose that we continue our dialogue, not only during the next, we wait 2 years for the next Geneva Health Forum, but we do our work here in Geneva to help the countries. Thank you very much again. Bye-bye.
And thank you very much to you, Andreas, and also to our panelists. I know that you're very embedded in this topic, but I still hope that you manage to take a few things away from this and learn a thing or two. So thank you very much for that. We only have 15 minutes until the next session, which is all about caregivers at the center of the second wave. So have your coffee, have your tea, and we'll gather back here very shortly, and we'll see you very soon. Thank you very much.